Hey everyone at Rock Steady, it's me and Dr. Johnson again, and we're going to be sharing a little bit about tips for eating. All right, hi Dr. Johnson.
Hi.
Would you mind sharing some methods to improve feeding for somebody who has Parkinson's? I know it can be especially difficult when individuals have a tremor and they've lost some of that strength in their grip and coordination.
Yes. Yes, definitely. Very important. So, again, we're going to be looking at the situation through those three lenses. First, looking at you as the person. And so, when you're eating, we might talk about how that's affected by the timing of your medication and seeing if there's some things that we can do and make that a little bit easier. The other thing we're going to look at is the position that you're sitting in when you're eating. Believe it or not, it's okay to put your elbows on the table, especially when you have Parkinson's disease, because that can add stability. In addition to that, we look at the stretching exercises that might be helpful to you prior to eating to kind of get you stretched out and practicing the movements ahead of time. The visualization, imagine yourself eating perfectly, not spilling things, not shaking. Talking through the steps can be helpful. 1, 2, 3, swallow. Again, consider using your non-dominant hand if your tremors are too much in your dominant hand. You also want to consider the reason that you are eating. You may want to eat a little differently depending on the situation. If you're just sitting there needing to eat and you're hungry, then probably maybe being in a place where you're not as distracted and everything is set up really well for you might be best. If you are in a social situation and really your goal is to spend time with friends or family, celebrating something, then maybe you want to consider foods that are a little easier to eat, such as finger foods. Then moving on to the environment, you want to think about what it's like if you're at home or if you're in a busy restaurant, if you're sitting in a bar or in a booth. So those different heights can make a difference and how stable you feel. You want to think about lighting and noise and visual distractions. If you're having to read a menu and it's already hard to read and it's already hard to process, and then have that extra challenge of, the lighting or the small font, things like that, that can add to your stress level. And so you may want to look at the menu before you go. Also, the utensils and the dishes that you use make a difference. So if you ever do go see an occupational therapist for this, one of the first things that they may start trying with you if you do have tremors is a weighted utensil. And this one probably weighs about half a pound, something like that. And those can be helpful for some people. In addition, some people will sometimes put wrist weights on people's hands, and that can kind of dampen the tremors a little bit. However, those are things that are maybe not as attractive, and you may not want to be doing those in a restaurant, drawing attention to yourself. So you could consider bringing your own utensils. And this is an example of some weighted utensils that are available on Amazon. This set right here seemed kind of nice and not real obvious. Also, you want to think about the stuff that you're using. You may just want to adapt. If you're eating soup, maybe you don't want to even deal with a spoon and you just pour it in a mug. Something that's large that you can just kind of put your whole hand into might be more steadying, and you might be able to do better with that. The other thing that I really like is Coban. It's called Coflex in this case. It's this stretchy stuff. Typically, it's available in the Band-Aid section of Walmart or someplace like that. But I find it's really helpful because it's kind of sticky and it gives some resistance to wrap around things to make them easier to grasp. And so, for example, you could take it, if you have a glass here, and if you're having difficulty holding onto it, it can make a big difference and make it just a little bit easier and more steady to hold. Also, another option is if your grip is a little weak and it's difficult to hold something smaller, you can have a tube and just put it over top of your fork, and that can make things a little easier to grasp as well. Those are all just some things that you can do to probably help to find some little strategies that make it go more smoothly. So please leave some information on Facebook if you've got a particular issue that you're interested in problem solving through. Maybe we can, toss around some ideas.
Yeah, I'll be sure to ask the boxers if they have any methods that they like using that they'd like to share.
Absolutely.
Thank you for sharing. I think that this will hopefully help some of them with eating.
Yes.
All right. Bye, Dr. Johnson.
Okay.